of like what kind of physical therapist you want to be. And then once you graduate, you work in different settings possibly, and you'll see kind of where you want to work. And it's one layer at a time. I always tell people it's like running a marathon. You're not going to get to the inline just yet, but where do you start is you have to start with, is this something that's even a voice inside of me? If you've had the desire and the passion, it will blossom, it will become something. After PT school, I just wanted to work. I wanted to start seeing what I liked. The frustrations of some things in the fields came up, and it just like kept watering that seed of I wanted to be my own business owner. Like I said, part of it was my personality is a little bit spastic, where I like to do lots of different things at once. I like to function that way. So I think I was working an 8 to 5, doing everything over and over again. I kind of remember the last time I really enjoyed work was when I was a resident, because I got to be a mentor, I got to be a student, I got to be a researcher, and I got to be a physical therapist. So if you're someone like that likes to kind of do lots of different things, business ownership is nice. And the first step usually is just knowing that's what you want to do, and then investing or talking to coaches, coach or someone who's done it will kind of help with that. But for most of you guys, I believe y'all are students or about to get going with your career. I just say, like, if that's something you want to do, write it down in your rotations, in your clinical rotations, start talking to people. It's amazing the connections that you make now, how they'll help you years down the line. Second question I get is that I am a cash pay practice, which is kind of new and upcoming for physical therapy, where I don't take insurance. I'm considered out of network. So people pay me a fee upfront, and then they get their therapy. And a lot of people go, who is going to pay you cash when we have our insurance and we already pay a lot for insurance? The people that are going to pay you cash are the people that take their health very seriously. When neurological conditions or concussions, there is not great information out there. A lot of people don't get continuous care. They see their doctors once every 6 months, and they just don't get one-on-one good type of physical therapy where you're addressing not only their physical impairments, you're talking to their caretaker, you're talking to the families about how you can manage their stress, you're giving them maybe new types of orthotics or equipment as they're evolving and changing, because you're seeing them the most. You end up becoming a vital person in their life. Cash becomes such a small price to pay when they realize the value that you're bringing to them. And like I said, I wanted to quit PT. Now I own my own PT practice. And so it took me a while to understand the value. What am I actually bringing these people? I kind of always thought if I'm not saving a life, then I'm not really doing anything, which is a very amateur way of thinking. And I realized, like, as therapists, we have a big job to educate not only the members of the family, the patient, kind of help them understand everything that's kind of going on, and also help them with their physical impairments, make their day-to-day life easier, make their quality of life easier. There's not a lot of professions or any professions that can do that. A lot of times they're here and they leave. We have this enormous blessing and responsibility to kind of be a cheerleader for these people and help be a problem solver. And for neurological patients, that is huge. A Parkinson's patient does not know how to get through a door without all of a sudden freezing. A physical therapist can teach them that. A spinal cord patient doesn't know how to get out of bed in the morning because they're paralyzed. A physical therapist helps teach them that. An amputee doesn't know when their orthotic starts to change in sizes because they're changing and they're moving and nobody's looking at it. A physical therapist helps with that. So we have a great value to play, and you learn a lot about this stuff. So people will pay the cash because look at the value you're providing. So always remember that. The third question I always get asked is this something that's too early to think about as a student? The answer is no. I think you're never too early to dream. You're never too early to dream and know what you want in your career. It's also okay if your plans change, because that means you're just evolving and growing. If it's something you like and it's something you're thinking about, shadow, go pick up the phone, call. I have students that just say, you know what, I'm just going to call and ask to see what I can do. And it's how you're building a connection. And like I said, these people are the same ones that will give you maybe your first job, that will rather give you some insight of what you do or you don't like, or help you down the line. The first job I got was through a connection I made through residency. So it's great to network. We don't learn a lot of business in PT school. And I will say, like, talking to people, and it doesn't have to be like annoyingly talk, like where you have to like go and like network and like sell yourself. Just if you like someone and like what they're doing, ask if you can go to coffee. Find an environment that works for you. Don't force yourself to be in a situation you don't want to be in. I'm an extrovert, but I do not like going and sitting in front of like a booth and telling people about me. I really like one-on-one conversations. I like going for walks. So I literally just, if people want to learn about me, I do it in a setting where I feel comfortable. And you don't feel like you have to put yourself in a situation you don't want to be in. So it's not too early to start thinking about this. It actually will just help you figure out like how to get closer to your goal faster. Why did I leave my job? Is another question I get. This is the 4th of 5 questions I get. I left my job. I was there for 2.5 years. My last job was outpatient neuro and vestibular concussion, which I loved treating. I was a little bit tired of doing things where it was kind of like I had to do it this way, and insurance was telling me how to do things. They told me I had this many visits. Every patient's different. You know, I didn't like being told I had to do this many hours of therapy. I wanted to be really customized and individualized to the patient. I really don't know if the 8 to 5 for physical therapy made a lot of sense. It was taxing to be on your feet working with people that are going through a lot, 8 to 5. So I wanted to shorten the hours I was actually doing patient care and spend my other time doing some other work. So like, I like making TikToks and being educational on TikTok. So I'll share a screen. I think I can't share a screen, can I, Megan?
I believe you can.
Let me see. It says host disabled participant screen sharing.
Oh, let me see.
Well, I'll show y'all if we can figure it out. It's just like, I wanted to be my schedule fulfilled with things that really I thought were effective. So I do patient care, but I also save other time to do, you know, and when I was working my insurance job, I couldn't always call the doctor really do things that really would improve the quality of life because they're so strict that you have to see a patient this many times, all these things. It was like not my own plan of care. It was somebody else telling me what to do. So let me see if I can share my screen. Oh, here we go. So let's go. Let me see if I can open up. Okay, so let's see if y'all can see. Can y'all see this? It's just my like Instagram. I like to make TikToks. So I literally make like stroke recovery, how it can, and I show patients before and after, concussion things, my toolkit for people recovering from vertigo, food for a healthier brain. And they're funny. I mean, I think they're funny. KR Neuro PT is the name of my practice in case you ever wanted to follow me there or ask me questions. It's right there, KR Neuro PT. And you can see I help active adults feel like themselves, dizziness, concussion, neurological, or acute or chronic pain. And I literally just make fun videos. And, you know, I think one of them went viral on TikTok. So I was pretty proud of myself. I'm too old for TikTok. So that was a big deal for me. But yeah, so I think that, like I said, I quit my job because I needed just more flexibility, creativity, just to be me and to get the best quality of care. Lifestyle matters. I did not think lifestyle mattered when I was 20 something years old, but now that I'm 30 and I have a husband and a house, I'm like, okay, yeah, I need to have some type of balance in my life. So that was important for me. Okay, the last question I get before I open up for questions is, where do I see the future of PT? Physical therapy, I think, is here to stay. I do think there's I do see more reimbursement cuts happening, meaning insurance is not going to pay a place that much for their physical therapy, and therefore we need to see more patients, which is why I think cash pay practice is becoming really, really common, and people are taking their health more and more seriously as we're learning a lot more about autoimmune, and we're learning about lots of diseases that are based on lifestyle. So I think PT is going to play a big role in preventative care as well as return to play type of care. I think it's here to stay. I think no matter what, every decade it's going to bring its hurdles and obstacles and then not some. I think the biggest challenge that we're facing right now is physical therapy is that we're still trying to look for direct access where people can come directly to you without having to see a physician first. People love the convenience of able to come to a physical therapist. I do see direct access patients, and it's so much easier than if they had to go through all these hoops. And I think that we're going to also play a bigger role in preventative care. I do think, though, that we'll see more cash pay practices out there. I don't think it's a fad. I do think it's something that is going to go in that way, which is good and bad. I mean, I would love for insurance to pay for us more, because that does mean that they're valuing it more. But I also respect the field a lot to know that you should get paid what you want. And so, if that means that we have to go towards a cash pay practice, that's what it means. So that's like a quick synopsis, a little bit about me, my 2 cents on being a business owner, or the questions that I had asked myself. But there's a lot to talk about business ownership, and there's a lot to talk about physical therapy. And so I'm open to questions. They don't have to be about anything in particular about owning a business, though it can be, or physical therapy or neuro, exactly what you can expect with that. So I'm going to open it up to questions. I'd love if you type them. Again, I really recommend if you unmuted and videoed yourself, because that would be great to see you, and we could have more of a conversation that way.
Hi, Rashi.
Yay, somebody unmuted themselves. Is that Zara?
Hi. Yeah, it's Zara.
Hi, Zara. How are you?
Hi, lovely to meet you. Thank you so much for speaking to us.
Of course.
I just wanted to ask, what's the most common neurological disorder that you've seen in your practice, or that you've seen in general, I guess, because you haven't.
Yeah, I've only been practicing March. In my practice, it's concussion, but overall stroke.
Mm-hmm. Cool.
I see stroke the most. Most of them being impaired gait, like they're not walking as well. And a lot of people don't know that you can get better with the stroke as even 6, 7, 8, 9, 10 months later. And they always see their neurologist maybe once every 6 months. And they can get a lot better. So stroke is the biggest thing that I see. It's also the number 1 reason for disability. I know in America, I don't know worldwide, but I see a ton of stroke. The second most I see after stroke would be Parkinson's disease, where PTs have a huge role in helping them kind of reduce the rate of progression. And there's a lot of research going into like the surgery side of Parkinson's, but physical therapy has shown how much it can help reduce the rate of progression. Lots of fun techniques you can do to help stroke and Parkinson's patients, and they will literally love you forever, because you're giving them information that no one's ever given them: how to walk better, how to get up faster, how to overcome obstacles they never did. It does take patience. It's not overnight. It does take a little bit of getting over that hurdle, but what I say would be the 2 diagnoses I see the most. I enjoy spinal cord the most, though. That's my favorite one. I think they're like so motivated, and it's so traumatic what's happened to them. So I think emotionally, I just like really feel for them. They're also so hardworking, and that's like probably one of the most fulfilling diagnoses I work with. Does that help answer your question?
Yeah, thank you.
Yeah, no problem. Okay, Miro asked a question. What is your new daily schedule as a business owner? How do you balance different responsibilities? That's a fabulous question. I'm working on this. My schedule is like, whoa. It's everywhere. I would say I see patients usually between 10 a.m. to 3. So in the morning, I wake up pretty early, like 7, wake up, have coffee, and I do a ton of like, if I want to send emails out to doctors, if I want to do some finance work, because I don't have a team yet. I'm still working on building that. If I want to order some equipment, anything like I call admin, I try to block from like about 2 hours of that, 7 to 9. I see patients usually from 10 to 3, even though right now I'm beginning phases. If patients want to come in earlier or later, I usually say yes. 10 to 3. Then I do paperwork, billing, all of that stuff from about usually like an hour. 3 to 4, send their exercises. And then I try to usually like work out, make dinner between like 4:30 to 6:30 is like kind of my time, my husband. And then in the evening, I again kind of rather catch up on now house chores, like my other stuff that I want to do, like if I want to hang out with friends, do anything like that, like just balance. Or if I want to spend towards my business, I can. But I pretty much, I do, I guess, like work 7 to 4:30, but I definitely make sure it's how I want to spend my time. I don't do only patient care, though. How do I balance different responsibilities? to-do list help, realizing asking for help when I need it. And I'm learning now that maybe I should start hiring people, because like when I write thank you cards, it takes forever. So, or I have to stop at the post office to mail them, or if I need to get exercise to a patient, it would be nice to have like an assistant. So I am slowly building up towards that. And I'm hoping in a few months I can hire somebody to kind of help me balance all my responsibilities. But I kind of love doing it all. It's fun. And because it's my practice, I've only chosen to take responsibilities that I really enjoy. I somehow really like math, but I think that's because I'm Indian. So I enjoy that. So I really like the finances, but a lot of people do like QuickBook Pro, like there's programs that help you. I mean, the internet is so helpful, but it's definitely doable, and it's your schedule. There's no one in charge. You get to choose how to do it. I don't usually like to work after 4:30, so I usually don't. That's a great question. Did that help answer your question? Of course. Okay, so good. Any other questions?
I'm
yes,
sorry.
Jennifer. Hi, Jennifer.
Hi. Thank you for giving this presentation so far.
Oh, you're so welcome.
How long, on average, do you see patients? Because it seems like there's a lot of longitudinal care. Is there an average amount of time that you see patients?
Yeah, I would say on average, I see my patients for an hour.
Okay.
I do mine for an hour. I do some follow-up visits. Like if you're seeing someone like a quick fix, like if they've done like a vertigo treatment, vertigo is quite easy to treat. I'll only do 30 minutes. On average, like an hour. I mean, today I spent a little longer on one just because as you start talking to them, more things come out. But I would say an hour is plenty. And an hour, I tend to always do some manual work. Manual tends to be very effective for my pain patients. Also, it's the only profession in the healthcare where we really touch our patients like therapeutically, not for assessments. We're actually touching them that make them feel better. And we can, as a therapist, you're going to become an expert at finding things musculoskeletal wise, or if that's like off or not aligned well, and you're just going to be drawn to it. I always tell people, like, how do you find these spots on me? You're just like, I don't know, your body just speaks to you, because in therapy and physical therapy school, it's like you will have a map of the human body and it will never leave you, which is so awesome. And I think it's such a cool skill. But about an hour. So I do about some manual work, and then I do maybe 20 minutes of that. Another 20 minutes goes towards like exercises, and then another 20 minutes goes to education, answering questions, helping them understand stuff, whatever direction it goes. So does that help?
Yeah, I mean, like, so how long, like, do you see your patients, like?
Oh, like long term?
Yeah.
So that's a great question. Concussion tends to be 2 months, vertigo like 2-3 weeks. My stroke patients, I usually do episodic, like 3 months, then they take a break, then another 3 months. Like if they have lifelong kind of conditions, usually people handle 2 to 3 months of therapy, they need a break from it. And I'm happy to give them that break. Usually I would say 6 months is probably an average of where I'm seeing a patient.
Okay, thank you.
You're welcome. Okay, I got another question from Mr. Zainib. I hope I said that right. What is something specific you do as a neurological PT that's different from regular PT? That's a great question. Okay, something that's different. There's lots of things. So let me kind of say, okay, what's different about neurological PT? One is your thought process is going to be a little bit different. So I like that every person has bones and tendons, and every person has a brain and a spinal cord. Okay, so it's not that one exists with the other. If you're a neurological PT, you will have your ortho skills. I touch people all day long to help them manage their pain if something's misaligned, because if they have like clonus or the spasticity, it's going to pull them in different directions. You're going to assess them and work on them just like you would if someone had like a tight shoulder. The difference is sometimes with neurological patients, they have things that you don't see otherwise, such as like Parkinson's, they have a tremor. If you have multiple sclerosis, you may have a really tight arm, like spasticity. So you learn how to work with maybe conditions that are a little bit, what I'd say, like some therapists are like, no, I don't want to touch that. Like, I don't know what that is. So I think one thing is kind of dealing with some complexities of the movement. You'll understand maybe why spasticity or tremors are affecting the movement, not just not just thinking about like the bone structures, but actually maybe how the central nervous system has affected the movement. So that's one, I would say it's like a big one, because whenever I'm working with people that have neurological impairments, my ortho friends are like, how do you deal with that? So that's one. Two, you're also looking at AFOs a little bit more. AFOs are like ankle foot orthoses, like supports you put on your ankle to help people walk. You're going to look at equipment a little bit more because sometimes they need a little bit more additional support. And 3, another something that's different about neurological is that the brain's involved. So a lot of times cognition's involved. So you have to deal with a lot of like anxiety or nonverbal cueing. That's very different from maybe normal PT, where they probably understand what you're saying, but there's a cognitive component. So you're going to work a lot with maybe speech or OT family members. So a lot of communication, a lot of education. Not that you don't do that with an ortho, but a different way, because maybe they're cognitively not doing it. So you have to be kind of creative in how you do things in that way. So the cognition is a big one. Understanding movement and all the different things, how it can affect is another one. Of how neuro PT is a little bit different, and then equipment. Does that help explain that? I'm waiting for him to answer to see if I explained it or if he has another question. In the meantime, if somebody else has a question, they can type it in or unmute. That's okay. My keyboard is always sticky, so no problem. Okay, good. Love it. Okay, that was a great question. Like I said, though, you will still do your ortho skills. You won't lose them. It's still very, very heavy on my manual skills. Any questions about PT school or the day-to-day of rather owning a business or just being an insurance clinic? Or if anyone wants to talk through, like if they're confused if they want to do PT or not. Can you explain more on your PT school experience? Yes, in particular, kind of when I wanted to quit, or just like how the day-to-day was. Day-to-day, okay. So PT school is tough. No one or nothing can kind of like can tell you really how grad school is going to be until you're in it. But it's intense. You're in school from 8 to 5. That was this USC. We were in school from 8 to 5. And it is a lot of information. I mean, it's anatomy, it's physiology, it's all the PT testing that you're going to do. It's lab work. There's cadavers. It's a lot, and most PT programs are small. I think USC is one of the biggest in the nation. We were a little over, just under 100. It is tough work, but it sticks with you. I don't know a physical therapist that doesn't know things, like people know stuff. Physical therapy, but they go over through everything. It is tough. It kind of reminds me of high school because you're in a small competitive environment, and so that can kind of get you like the pressure and everything. But at the end of the day, remember, PT school is not grade school. It's not about making the grades. It's about learning a profession so that you can become a great professional. And the difference there is that you're doing one for yourself, and the other you're doing it for a whole career. You do a lot of studying. You will have study groups, but the day-to-day pretty much is I'm in school from 8 to 5. Usually I would go home, and then my roommates and I would be studying together, and then you do your homework, and then it's the next day. And it was just like that. And on top of that, you're doing some extracurricular stuff. You're doing extracurricular things, and then you have rotations. We're actually learning, and you're going and you're practicing, which you really enjoy. So it's a busy time, but you're in your own bubble. And if you're committed to it, you will be just fine. Does PT school run on a pass-fail system, or does it use a traditional grading system? Every school is different. There's not one standard across. So we had mainly a traditional grading system, like A, B, C, D. Some classes were pass-fail, like I think like ones that weren't like high on the list. They just needed you to pass it. And I think it's just because they needed you to learn it for the boards. But most schools actually are traditional and what they do there. What are exams like in PT school? Okay, exams in PT school, it matters. Like if it matters on the subject matter. So if it was something like it was a lot of like charts, and you had to like label things. I think one time we had to go to the cadavers and name all the different muscles. You do lab portion where they act as the patient and you work on them, and they see your clinical diagnosis and your clinical decision making. That's what they're really looking at. Because in PT, the truth is there's no right answer. You will get tired of hearing them say, well, it depends, because the human body, it depends. And so they want to see, how do you get from one thought to the next? What testing are you doing? There's multiple choice for the things that are just like fact-based, like anatomy is fact-based. But if a patient comes in and they are having shortness of breath, they want to know, like, how are you interviewing them? What tests and measures are you doing? What are you telling them? They want to see your thought process there. If they have a torn ACL and they're in week 4 of their rehab, what exercises are you choosing? Why are you choosing them? Again, there's no wrong or right answer. They want to look at your clinical judgment. So the exams are mixed. I remember the most different thing about PT exams is the live portion. A lot of it is a lot of live stuff going on. Do you have to revamp your studying in PT school? Oh, like do you have to do a lot more studying in PT school compared to undergrad? I did. Yes, I did. Like I said, I wasn't a kinesiology major. I was a PR major. So I think that was part of it. I didn't have all of it, but I really like but they kind of start you from like level 1. So it's okay if you come from different backgrounds. And there's a lot of knowledge, like even learning the gait cycle, like learning like what it takes to take a step. You have to know what angles every joint is, what muscles are all involved, which ones turn on, which ones turn off. So it's a lot of studying, but it's fun because you move a lot, you take a lot of videos, you learn a lot of cool stuff about the human body. You meet people who are just transcendent in this field. So it's really interesting. I mean, some classes are not interesting, but it is really interesting. So you do have to revamp your studying. And I think it's for 2 reasons. One, there's a lot of material. 2, you just probably care more than you did in undergrad. So you're going to put more effort into it. So it's tough, but like, don't let the fear of it stop you. I mean, if it's something you like to do, you'll do it. So it's not undoable. Lots of people become physical therapists who don't take the time to come to seminars and listen to things. And I think you guys will do fine. You just have to be kind of strategic and consistent with planning, with your studying. But they don't give you much of a life anyway, so all you're doing is studying. Like I said, it's okay. You're welcome. Those are great questions. I speak a little fast, so if you want me to repeat anything, let me know. We do have about 7 minutes, so any other questions about post-school life, working? Have you heard things that scared you or anything like that I can kind of shed some light on? I'm happy to. What are your most rewarding experiences with a patient? Oh gosh, there's so many. One is like one easy answer to that rewarding experience is that when they just get better and they say, oh my gosh, like no one's helped me understood this before. That's like this, you'll hear that all the time. A lot of people come to PT because a lot of people were like, we don't know what to do, go see a physical therapist. So one girl was having a lot of dizziness and they couldn't figure out what's going on with her, and everyone just kind of shoved her off to the side and said she had anxiety, and helping her understand what she had and working through it was so rewarding, and she's doing phenomenal. And she's actually something that followed me into my own practice. So it's a really easy one is when you just make them feel better. But the most rewarding experience I had with a patient is who I learned from. His name was Capen, 24-year-old who was in the minor leagues for baseball, and he went to like a Christian youth group, and he was really active, great guy. And I didn't know him at this point. I met him when I was a student, when I was 26. My business name is called KR NeuroPT. KR, the K stands for Capen because he had such a big influence in my life. My husband's name also just a K, so he's part of it as well. And then R is my name. But Capen was a baseball player, or going to be 22, 23, really athletic, strong, went to bed one day and was feeling numbness and tingling and like not speaking well. And he was like, must be tired, called his mom and was like, I'm not feeling well. She goes, well, just rest. And he's like, okay. He woke up and all of a sudden he had something called locked in syndrome, which means you're completely locked in your body. You cannot move, do anything, but you're cognitively completely aware. And all you can do is blink your eyes. So he knows everything that's going on with him, but he cannot move or do anything. And he's completely paralyzed, and they don't know what happened. To this day, they don't know what happens. I think he's almost maybe he's almost like 32. It's been like 10 years. And I mean, literally overnight, you don't hear that. He literally, I know, it was terrifying. Like he literally woke up and just like was like, couldn't move, do anything. And it didn't get better. And I met him about a year in, when I was in California doing my rotations. And his goal was some of his youth members would come visit him, and all he could do, eventually he got thumb movement so he could text. And he fell in love with this girl, and they ended up getting engaged, and he wanted to stand up for the shoot. And I mean, they never talked. I mean, they only texted, and she just fell in love with his heart. And he wanted to stand up for his engagement shoot. And we were working on getting him to stand. And I remember we were helping him stand, and his body kind of like jolted, like had a spastic attack. And after the end of the session, I always wanted feedback. And he texted me saying, "Sorry about the jolt. I trust you. My mind trusts you. My heart trusts you, but my body and mind have betrayed me." Meaning he's like, my body betrayed me, and therefore I didn't trust you. And I thought it was such a touching moment. And it was the most rewarding experience that someone who probably lives in fear trusted me to help him stand for such a big moment in his life. We got him standing. He stood up for his engagement shoots. It is adorable. If I have time, I'll show you his, actually, I'll just show it to you because it's so worth it. I'll show you him right now. And he stood up, and he's even walking on a treadmill now. And he writes, he's become a motivational speaker. He's become a motivational speaker. So that's him and his wife right there. He's become a motivational speaker. Even though he can't talk, he just like types and things speak. And I'm just trying to see if there's a video. I think there's a video of me walking him a little bit. But that's him. That's him and his friends. I don't know if y'all can see it all. Hopefully you can. He's got one hell of a character. But that's him. He's like really into his faith. There's a lot of, and that was him before, like just a normal ass dude. And this is now him and his wife. And I'm trying to find the engagement photo for you guys, but I don't want to take up all y'all's time. That's therapy and water. Let's see. That's when we stood him up for the first time. Let's see. Anyways, I can definitely try seeing if I can find it for you guys. But yes, that was probably the most rewarding, is just being the fact that someone would let you into that part of the life is so beautiful. And those stories you hear often. So any other questions? Got 3 minutes. Yeah, that one's, it's crazy. It's so crazy. Oh, that's a good question. Why did I jump? So I was a PR major, wanted to do journalism, and I really also had this like science part of my brain, and I thought I was going to like maybe do med school. And I wasn't ready to commit to something where I wouldn't be able to do science at all. And I was a dancer in college, and so a lot of my friends had gotten injured, and like being able to, I really liked understanding like what happened and why they were the way they were. And so, and I really like running and dancing have been really great in my life for me. I really have enjoyed it. Like I thought it was so important to really talk about like physical fitness for people. And so I think I got into it because I really liked that aspect of it, but it wasn't so like strict, where you could create on treatment plans. And so that's what made me kind of jump from PR to PT. But I now use a lot of my PR skills as a business owner. So it was, I still like to write and do media and all of that stuff. Any others? I'll give it like 20 seconds and then we can like wrap up. If you guys have any questions, you can follow me at KR Neuro PT on my Instagram, or you can like DM me, and if you want to like talk, we can email or have a phone conversation, anything like that. Please use me as a resource. I am happy to. And it was such a pleasure talking to you guys. Thank you all for taking some time out on your Tuesday evening to talk to me. I loved being here, and I'm going to give it back to Megan.
Okay. Thank you so much for that presentation. If you guys have not seen it already, I posted the certificate link in the chat. So go ahead and fill out your certificate. But if you have any way of contacting you, you can also feel free to drop it in the chat, Dr. Rashi.
Yes, I put my Instagram and my email. I'm on Instagram and email all the time. So those two would be great. You're so welcome. I hope this gave something interesting for you guys. And like I said, questions may come up later. So don't think you missed your chance. Ask me anytime.
Thank you so much.
Thank you, Megan. Great job to Megan, her first time hosting. That was very good. And thanks to everyone for